Hello, team, and thank you for attending our annual town hall. This year is so very different from any past year in my 35 years here at Englewood. And I hope we can come together today to reflect, to recognize, and to reinforce all that we have accomplished, and to celebrate together. I'm also happy to share more details about our future plans to take Englewood to the next level in healthcare and in nursing. It's important for all of us to take some time to reflect and celebrate together on all we do as a team and as nursing professionals. And I'd like to take a moment and give you my best remote version of applause and a virtual hug. Please join me in recognizing yourselves and each other. I thought about how busy this year has been and how our actions have impacted everyone around us, our colleagues, our patients, and the communities who depend on us. We have changed lives and made an indelible impact. I want to commend each of you for your role in getting us through this year and serving as role models as the world was watching. Our collaborative approach to nurturing nurses through education, professional development, collaborative practice, teamwork, and autonomy will certainly continue to result in actions that ignite impact. So I'd like to provide an update highlighting our major accomplishments since 2018, when I took on the role of Chief Nursing Officer. I hope you all got a chance to review our recent biannual report highlighting our nursing team accomplishments in 2018 and 2019. I want to point out some of the successes from our strategic plan. Our certification rate among our nurses increased from 38% to 48%. Well done. The BSN rate went from 83% to 86%. So we are so proud of our certification rate increases as well as our BSN percentages. Well done, team. In addition, 17 staff nurses have been promoted. I am so proud that our talented nurses are taking advantage of growth opportunities right here at Englewood. 47 of you earned a basic certificate in quality and safety through the Institute for Healthcare Improvement. And we launched our nurse residency program with 27 nurses participating so far. Our nurses completed nearly 31,000 contact hours in our CE Direct program. Our unit-based teams, led by clinical nurses, continue to grow and take on new projects, and we launched our night shift team. There is much more, and I invite you to keep informed and refer to our nursing publications for more details on how to get involved in the future. The overarching approach to achieve our successes has been our commitment to shared goals and mutual trust. We are all in this together, and we've heard this many times, and for us, it's always been a hallmark of nursing at Englewood. We have talked about a sense of family here. It's what makes Englewood Health so special. Many of you know Neilio or Lindy Abdan. They both started here together on the same day 20 years ago. And just a year ago, their daughter Nicole joined our nursing team here at Englewood as a nurse on 4D. Let's listen to their family's story.
I like to be a nurse because every day you meet a different kind of people, and I love taking care of them. It's my joy and it's my passion to take care of them.
I'm taking care of both moms and babies at the same time. So the positive, exchange between patient and nurses, I'm very happy about it.
We were classmates in nursing school.
In college.
In college, way back 1987. I saw her on the back, laughing and smiling, and I said, that's a beautiful girl. Everybody in the Philippines wants to go to the United States. it's a dream come true.
So Englewood Health is really a great place to work because staff are really good at helping at each other when it comes to working on the floor. So the teamwork is just amazing. And on top of that, our nurse managers is so easy to communicate with, and they have this open door policy that they call that, and everybody's always welcome in their office.
It's my pride that 3 of us are here, especially Lindy and I are here, and then additionally Nicole. She became a nurse also. It's our pride, and that goes to my heart. It's deep, yeah.
I have coworkers that, would tell me how caring she is and how good and nice she is to the patient. So I'm very proud about that.
Hearing all the time that my parents were great nurses definitely made me want to become a nurse. The first thing that people generally will say to me is, "Does your parent work here?" And my first answer is always, "Yeah." Are you talking about my dad or my mom?
You go to work, although you don't see each other at work, but you know that they're here. I feel that this is an extension of our house, our home.
When 2020 started, we were full steam ahead, fully immersed in our strategic plan, and then the pandemic hit. We found ourselves in the epicenter. Our nurses and team members from all disciplines across the hospital demonstrated an unwavering commitment to provide the very best care possible under the most difficult of circumstances. But as a family does, we came together and helped to pick each other up, and we got through this unimaginable experience together. Our true colors came through. Words cannot express enough the gratitude I have for you and your dedication to our colleagues, our patients, and our community. Your actions ignited impact during the most critical of times for our nation. It was not only your compassion and teamwork, but also your talent and innovation that helped us get through the crisis. For example, our redeployed staff joined together with the unit staff and supported them in so many ways. Many of you shared with me how you were glad to be able to help. You found new respect for each other, and you made new friends. You quickly figured out new ways to provide care, like managing pumps and ventilators in the hall, or managing visitors over iPads, opening a comfort care unit on 4 East, and new proning protocols. These were days like none we could have imagined, but I could not be any prouder of the commitment you showed to our patients, and yes, the amount of teamwork that was essential. 2020 has been designated the Year of the Nurse by the World Health Organization. This year also marks the 200th birthday of Florence Nightingale, an innovator who changed the face of nursing and healthcare. And National Nurses Week in May was meaningful not only to us, the nurses, but to our colleagues and our community. We were able to shine a light on everything you do and celebrate your accomplishments together. I heard such great feedback about the activities during Nurses Week, and thank the team that worked on it so hard around the clock to make it all happen. We also celebrated a transformative gift from Maggie Kaplan and the Kaplan Foundation, dedicated solely to nurses and the future of nursing. It was the largest gift in the history of Englewood Health. This gift has established the Kaplan Institute for Nursing Excellence. For decades, Englewood Health has been recognized for the exceptional quality of care you all provide. Among our recognitions are 4 consecutive magnet designations. We are committed now more than ever to delivering an exceptional patient experience and building a stronger and more vibrant nursing team at Englewood. The Kaplan Institute for Nursing Excellence will enable us to not only dream big, but to provide the resources necessary to provide every opportunity for our team members to pursue their professional development goals, academic goals, innovate, conduct research, and focus on an exceptional work environment. Together, we will ensure Englewood Nursing leads the way and has a lasting impact on our team members, on our community, and future generations of nurses to come. Thank you, Maggie, for your unwavering commitment to our nurses and our community. I am so pleased to be able to share some of the details about the Institute. Please continue to stay tuned as we move forward. Within the Institute, we are creating 5 centers: Professional Development Center, Nursing Pathway Center, Nursing Research Center, Nursing Innovation Center, and the Nursing Practice Center. In our Professional Development Center, we will open our new state-of-the-art simulation lab to provide trainees with innovative hands-on experience. Our preceptor program will elevate the program offerings that we currently provide to team members, giving a better experience to both the orientee and the preceptor. We want to continue to expand recognizing and rewarding excellence, and will create opportunities for staff and team members to attend national meetings and conferences that offer insights into best practices. A growing number of nursing hopefuls and professionals voice concern about the debt incurred as they pursue higher education. Our Nursing Pathway Center here at Englewood Health will enable our top talent to secure degrees in a variety of specialized fields. Ultimately, this highly educated workforce will be positioned to deliver service excellence to patients and families. We'll be forming academic partnership programs with neighboring institutions to provide educational opportunities for nurses at all stages of their career cycle. We'll expand our nursing residency program beyond new graduates to include those in nursing leadership, educator and faculty roles, as well as advanced practice nurses. We're so excited about the scholarship program. We'll be able to offer opportunities for current and aspiring nurses to pursue educational advancement, and we'll have career guidance programs in place. The Career Guidance Program will serve as a resource for current and aspiring nurses to promote access to career advancement opportunities. In addition, we'll offer nurse fellowship programs. We're looking to create clinical leadership succession plans and a pipeline that supports and aligns with our strategic plan and objectives. Stay tuned for additional information on this exciting scholarship program available to all our team members. We are also looking to formalize and put in place an internship program for student nurses. We are looking forward to launching our Nursing Research Center. In the center, we will have a formalized approach that can create dramatic change for the field of nursing research at Englewood Health. Via the Nursing Research Center, we will recruit nurse scientists to support both qualitative and quantitative research, design, implementation, and completion of research that advances the mission and vision of Englewood. These roles will also mentor staff in the conduct of evidence-based practice studies, conducting literature reviews and research, as well as supporting interdisciplinary research. Opportunities to partner with academic institutions will be pursued as part of this initiative. In our newly formed Nursing Innovation Center, our goal is to improve outcomes and achieve top national ratings. As we continue on our magnet journey, we look to support staff through full engagement on their unit-based teams. We're all committed to quality and patient safety, and through the Kaplan Institute, we will be investing in resources to support the frontline staff in improving quality and safety. Through collaborative practice, we'll work on teamwork and high reliability training, as well as invest in resources to support data, and analytics. We remain laser-focused in providing an exceptional patient experience to our communities. We'll focus on training in both customer service and coaching at all levels for exceptional experience. Our fifth and final center is the Nursing Practice Center. The well-being of nurses is fundamental to the health of our nation. To foster healthy nursing practice, Englewood Health is committed to the development of programs that will provide our nursing team members with access to services that promote healthy lifestyles. Our focus will be on caring for the caregivers, physical and mental wellness, and a healthy workplace environment. You'll be hearing much more about the Kaplan Institute and these programs over the next year. In tandem with the Institute, we are working on updating our nursing strategic plan. Thank you all for the feedback that you provided that allows us to frame the goals for the coming years. Our plan is based on our professional practice model, covering patient care management, nursing practice, professional development and teamwork and autonomy, collaborative practice, community outreach, and leadership. Earlier, we talked about our successes in achieving our strategic goals. Now let's listen as Rosemary Wright shares her experience at Englewood.
What I love about nursing is helping, educating my patients. It just makes me feel good that I'm helping someone to feel better. And if they're not feeling better, helping the family to transition. Yeah, Tricia updated this. My younger brother was a sickle cell patient from he was a little boy. So basically, I'm always taking care of somebody, and my father got sick when I was in high school and subsequently passed away. So I always wanted to be a nurse. I started as a secretary in the ICU, which was a wonderful experience. The nurses there were really great mentors, especially in the PCU area. And then I became a nurse. So I went to 16 as a staff nurse, and I did that till now. The difference is in between the process of being a nurse, I was able to transition from being a regular staff nurse to precepting, to help with other projects on the floor to make our floor better, function better for everyone. And then transitioning from that to charge nurse, and then from charge nurse to care manager. When I got the Daisy Award at the beginning of January, that's the first time I really realized how much I made a difference in somebody's life. I know how it feels on the other side, that when you're in the hospital, you expect something different than when you're at home. So if we have the noise down and we're a little bit more, we're educating the patients better, talking to them more, interacting with them more, we can get better outcomes. When Epic was coming to the floor, because I was a super user before for the other computer system, I decided to volunteer to be a super user as well. We just went to get to know the system so that we could teach the other nurses on the floor. My one advice I would give to younger people is never be afraid to move, to do something different, to challenge yourself. Because I could have been a care manager a long time ago, but I was always like, no, second guessing myself, just wanted to do what I wanted to do at bedside. And now I am a care manager, and I could do so much more. I could still be at the bedside and still manage and help to streamline the floor to be a better floor. I have never regretted one day. My life as a nurse has been amazing.
So what else is in our future? A lot, and it's very exciting. As you know, we are undergoing regulatory review for our upcoming merger with Hackensack Meridian Health. We anticipate a decision after the new year. This merger will be an incredible opportunity that will have a great impact on our patients, our community, and give many opportunities to our nurses to engage in professional development, research, and innovation. This year has been one of action, one of challenges, yes, but also successes and accomplishments. And no matter what challenges may come our way, our community knows our nurses are ready. I am deeply appreciative and filled with gratitude for all that you do each and every day. Your actions will ignite impact in our next chapter, and together we can lead the way for nurses here at Englewood and beyond. Please stay well, take time for yourself and your families, and I look forward to seeing you soon. Thanks for being present, stay healthy, and stay safe. Also, one last thought. Our annual Nursing Satisfaction Survey runs now through October 25th. The survey is a great opportunity to show pride and team spirit in nursing at Englewood. I ask you to please participate, provide the feedback, and help our teams to make Englewood a leading example and top destination in nursing. Thank you.